The most dangerous stroke warning is not always the one that knocks you down. Sometimes it shows up for a few minutes, then disappears before you even know what to call it. You feel strange, then normal again, and your mind starts making excuses. Maybe you were tired, maybe you stood up too fast, maybe it was nothing. But a warning that goes away can still be serious. Today, you are going to learn what those early stroke warnings can look like, so you know when to stop guessing, call for help, and protect yourself or someone you love. When a warning lasts only a few minutes, it may not feel urgent enough to scare you. You have a strange moment, feel better, and decide it is over. This video is here to help you do the opposite. Notice the warning. Take it seriously and get help while help can still make a difference. Number 5. Sudden severe headache. This one is difficult because headaches are common. You can get a headache from stress, poor sleep, dehydration, neck tension, skipping meals, bright light, or a long day in front of a screen. So when your head starts hurting, your first thought may be that it is just another headache and you already know what to do. But the kind of headache you need to respect is the one that feels different from your normal pattern. It may come on fast, without any clear reason. It may feel stronger than the headaches you usually get. It may make you stop what you are doing because something about it feels wrong. You might not have the perfect words to explain it, but you know it does not feel like the kind of headache you normally handle at home. Most headaches are caused by something other than stroke, so you do not need to be afraid of every small pain in your head. The concern starts when the headache is sudden, severe, and unusual for you, especially when it shows up with another change in your body. The mistake is trying to wait it out because you do not want to bother anyone. You sit down, take something, drink water, and tell yourself you will see how you feel in an hour. That may feel reasonable because you have handled headaches before, but a stroke warning is different because time matters. If the headache is sudden, severe, and unusual for you, especially with trouble seeing, speaking, walking, thinking clearly, or moving one side of your body, call emergency help. This is not the moment to drive yourself to the clinic or lie down for a long nap to see if it passes. If it is a stroke, doctors need to know when it started, and getting checked quickly can make a real difference. A simple question can help you in the moment. Is this normal for me? If you know your usual headaches and this one feels different enough to worry you, listen to that concern. Your body does not need to give you a perfect explanation before you take it seriously. This matters even more if you are over 60, have high blood pressure, diabetes, heart disease, high cholesterol, a smoking history, or you have had a stroke or mini-stroke before. Those risk factors do not mean every headache is dangerous, but they do mean sudden changes deserve more respect. If you live alone, make it easier to act before anything happens. Keep your phone close enough to reach. Keep a written list of your medications somewhere easy to find. Know who you would call if you suddenly felt wrong and needed help. This is the kind of preparation that is easy to put off because you assume you will think clearly in the moment. But when something frightening happens, people freeze, argue with themselves, or look for a calmer explanation. Having a simple plan removes some of that hesitation. The headache warning belongs on this list because people are used to pushing through pain. But if your head pain shows up suddenly, feels severe, and does not match your normal pattern, it is better to be checked and find out it was not a stroke than to stay home and miss the window where help matters most. Number 4. Sudden vision changes. This warning can fool you because it feels like an eye problem. You might be reading, watching television, making breakfast, or walking across the room when your vision suddenly changes. One eye may go blurry, part of your sight may fade, the room may look strange, or it may feel like a shadow moved across your vision. Then, before you can fully explain what happened, things look normal again. Once your sight comes back, it is very tempting to move on. You might blame dry eyes, old glasses, bright lights, or standing up too fast. Sometimes those things really do affect vision, which is why this warning can be confusing. The part to notice is how suddenly it starts. Slow vision changes that happen over weeks or months belong in a different category. Those are things to discuss with an eye doctor. But vision that changes in seconds or minutes, especially if it feels unusual or affects one eye, needs urgent attention. This is the pattern people miss. The vision changes quickly, clears quickly, and then your mind treats the problem as finished. But when a stroke warning disappears, the danger may not be finished. It can mean blood flow was briefly interrupted, and even if it returns, you still need to know why it happened. If this ever happens, try to remember the details without wasting time. Was it one eye or both eyes? Did your vision go dark, blurry, doubled, or missing on one side? How long did it last? Did it come with dizziness, weakness, confusion, headache, or trouble speaking? Those details can help the medical team, but the main decision is simple. Sudden vision changes should be treated seriously, even if they clear up. Please do not drive after a sudden vision episode. You may feel fine again, but you do not know if it will return on the road. Call emergency help or have someone get you help safely. If it happens to someone you love, take it seriously even if they look normal afterward. This is where families often lose time. The person says they feel fine, everyone wants to believe it, and the moment gets explained away. A few minutes later, the whole thing becomes a small story instead of a warning. You do not need to accuse anyone or scare them. Just be calm and firm. Tell them a sudden vision change should be checked because it can be connected to stroke or a mini stroke. The fact that they feel better is good, but it does not answer the bigger question. A helpful rule is this: slow vision trouble can be an eye appointment, but sudden vision trouble deserves urgent help. That rule is easy to remember when the moment feels confusing. The reason this sign belongs here is because sight feels separate from stroke to many people. They think stroke is only about falling, paralysis, or not being able to talk. But the brain and the eyes depend on steady blood flow. When that flow is interrupted, vision can be one of the first things to change. It also helps to tell someone right away. If your vision suddenly changed and then came back, do not keep it to yourself because you feel silly. Tell a spouse, a child, a neighbor, or whoever can help you get care. A short warning is easier to ignore when you are the only person who knows it happened. So if your vision suddenly goes wrong, even for a short time, do not treat it like a normal tired eye moment. Get help, explain exactly what happened, and let doctors decide what caused it. Number 3. Sudden numbness or weakness on one side. You have probably had an arm or leg fall asleep before. Maybe you slept in a strange position or leaned on your elbow too long. It tingles, feels strange, and then improves once you move around. That kind of numbness usually has an obvious reason. A stroke warning feels different because it comes out of nowhere. You could be sitting at the table, walking through the house, getting dressed, or holding a cup when one side of your body suddenly feels wrong. Your hand may feel clumsy, your arm may feel heavy. One side of your face may feel numb. Your leg may feel weak, like it is not following your command the way it usually does. Then it may get better. That is the moment when many people start explaining it away. They think it was a pinched nerve, bad posture, or something that comes with getting older. Since the feeling passed, they decide not to tell anyone, but sudden numbness or weakness on one side of the body is one of the clearest stroke warnings. The key detail is one side. One arm, one leg, one side of the face, or one side of the body suddenly feels weak, numb, heavy, or hard to control. That is very different from both feet tingling after sitting too long or both hands feeling numb because of a neck or nerve issue. If one side changes suddenly, treat it seriously. You might notice it in small ways at first. A cup feels harder to hold. Food slips from one side of your mouth. Your smile feels uneven. One foot drags for a few steps. Your hand does not button a shirt the way it normally does. Those small moments matter because a stroke warning does not always arrive looking dramatic. Sometimes it looks like your body briefly stops working the way it should, then recovers enough to make you doubt yourself. If this happens to you, call emergency help. If it happens to someone near you, do not ask them to keep testing themselves for a long time. You can ask them to smile, raise both arms, or repeat a simple sentence while help is being called, but the testing should not become an excuse to delay. When you talk to the medical team, be specific. Say which side felt weak or numb. Say what time it started. Say how long it lasted. Say whether it happened before. If it improved, tell them that too. The fact that it improved is important information, not a reason to hide it. This is especially important for people who do not want to be a burden. Many older adults are so used to staying strong for everyone else that they minimize symptoms. They say they are fine now because they do not want to cause trouble, but telling the truth quickly can protect your independence. If you are listening to this and thinking you would never want to bother your family over something that only lasted a few minutes, please hear this gently. A short warning can still be the moment when your family would want you to speak up. They would rather get a call that turns out to be okay than find out later that you were trying to protect them from worry. A stroke is one of those situations where waiting quietly does not help anyone. Getting checked does not make you weak. It gives you the best chance to catch a serious problem early. So, remember the simple pattern: sudden change, one side, weakness, or numbness. If those three things happen together, even if they pass, get help. Number 2, sudden balance or walking trouble. This warning can look ordinary from the outside. You take a step and suddenly feel off. You veer to one side, grab the wall, miss the edge of a step, or feel dizzy in a way that does not match what you were doing. A moment later, you may feel steady again, which makes it easy to blame the floor, your shoes, your blood pressure, or age. Everyone trips sometimes. Everyone can feel lightheaded once in a while. The warning here is a sudden balance problem that does not make sense for the situation. You were on a flat floor. You did not just spin around. You did not rush out of bed. You were doing something normal, and your body suddenly did not move normally. That is worth attention. Stroke can affect the parts of the brain that help with balance and coordination. When those parts are not getting the blood flow they need, you may suddenly stagger, lean, feel pulled to one side, or walk like you are unsteady even though nothing obvious caused it. A lot of people laugh this off because they feel embarrassed. They say they are just clumsy or their legs are not what they used to be. Sometimes they say they must have stood up too fast because that explanation feels less frightening. But sudden trouble walking, dizziness, loss of balance, or lack of coordination is a recognized stroke symptom. If it appears suddenly, especially with weakness, vision changes, confusion, speech trouble, or a severe headache, do not wait around to see what happens next. Sit or lie down somewhere safe and call for help. If someone else is with you, ask them to stay nearby. If you are alone, keep your phone close and unlock your door if it is safe to do so help can reach you. Please do not try to prove you are okay by walking around the house again and again. That can lead to a fall, and it wastes time. What matters is why your balance suddenly changed, not whether you can force yourself through it. If you are with someone who suddenly cannot walk normally, be calm but do not be casual. Tell them you know they may feel better now. But a sudden balance problem should be checked. People often need someone else to take the moment seriously because they are already busy explaining it away. This sign is also important because dizziness can have many causes. Inner ear problems, dehydration, medication effects, and blood pressure changes can all make someone feel dizzy. That is why the sudden pattern matters so much. Dizziness by itself can be confusing, but dizziness with trouble walking straight, one-sided weakness, vision changes, speech problems, or confusion should be treated as urgent. You do not have to know the cause at home. That is what medical evaluation is for. The part you can control is not ignoring the warning. If your walking suddenly changes, or your balance suddenly feels wrong in a way you cannot explain, take it seriously. A warning that passes quickly is still worth checking, because the next episode may not pass as easily. Before we move to number 1, remember that balance problems can also lead to injuries. A fall after 60 can create its own serious problems, even if the cause turns out not to be a stroke. So the safest move is to sit down, call for help, and avoid trying to handle it alone. Number 1, sudden speech trouble or confusion. This is the warning I would want every family to recognize. Forgetting a word once in a while is normal. You may forget a name, lose your train of thought, or walk into a room and forget why you went there. That happens more when you are tired, stressed, or distracted. The speech trouble we are talking about starts suddenly and feels unusual. You know what you want to say, but the words do not come out right. Your speech may sound slurred. You may say the wrong word and know it is wrong. You may try to answer a simple question and feel stuck, as if your mouth and your thoughts are not working together. It can also happen the other way. Someone is talking to you, but for a moment their words do not make sense. You hear them, but your brain is not putting the meaning together the way it normally does. You may feel confused, embarrassed, or frightened, and then everything clears. When speech comes back, people often want to pretend it did not happen. They feel embarrassed and decide not to mention it. Or the family laughs nervously and says it was probably just a moment. That reaction is understandable, but it can waste time. Sudden speech trouble or sudden confusion is one of the most important stroke signs. If words stop working, even briefly, call emergency help. This is different from normal forgetfulness. It is a sudden break in your ability to speak clearly, understand someone, or act like yourself. If you notice it in someone else, ask a simple question. Ask them to repeat an easy sentence. Ask their name. Ask them to smile and raise both arms while help is being called. If their words are slurred, mixed up, missing, or they seem confused by something simple, treat it as urgent. They may get annoyed with you. That is okay. It is better to make an uncomfortable call than to stay polite while someone may be having a stroke. If it happens to you, tell someone immediately, even if it passed. Use plain words. Say, "My words were not coming out right." Say, "I could not understand what you were saying." Say, "I felt confused for a few minutes." You do not need medical terms, you just need to be honest. Doctors need the real story, including the part where it got better. A mini stroke can feel temporary, but it can still be a warning that a bigger stroke may happen if the cause is not found. That is why you should not wait for it to happen again. The first episode is enough reason to get help. And please remember this about stroke symptoms. You should not drive yourself. You should not take aspirin or blood thinners on your own unless a doctor has already told you to do that for your situation. Some strokes are caused by bleeding, and taking the wrong medication at the wrong time can be dangerous. Let medical professionals decide what is safe after they evaluate you. If you live with someone, talk about this before there is an emergency. Tell them that if your speech suddenly changes, you want them to call for help instead of waiting for you to agree. In the middle of a stroke warning, you may be confused, embarrassed, or unable to explain what you need. Having that conversation ahead of time can make it easier for the people around you to act quickly. A stroke warning can last only a few minutes and still matter. It can disappear and still deserve urgent help. It can make you feel normal afterward and still mean something serious happened. So if you or someone you love suddenly has speech trouble, confusion, one-sided weakness or numbness, trouble walking, sudden vision changes, or a sudden severe headache with no clear cause, call emergency help right away. You do not have to prove it is a stroke before asking for help. If it looks like it could be one, act first and let the doctors sort it out. Now we want to hear from you. Have you or someone you know ever had a strange warning sign that disappeared and was easy to ignore? Tell us in the comments below. We read every single one. And if this helped you understand what to watch for, please give this video a like and subscribe so you never miss what we cover next. Thanks for watching.